Back pain can be one of the most challenging things to diagnose and treat. The problem with that is there's so many contributing factors that go into back pain. There could be acute trauma, an accident, or an injury, which is typically pretty easy to understand. I mean, if we were to bend down and lift something and strain our low back, that makes sense. Where it gets challenging is when we start to manage these conditions without a specific cause or contributing factor. And typically this is what we see the most of here in the clinic. You know, the back pain that occurs when you wake up in the morning. You didn't do anything over the weekend, you didn't, injure it playing a sport, you just developed this kind of non-specific back pain. So degenerative disc disease, degenerative joint disease, arthritis, sprain strain, sciatica. There's so many different diagnoses for low back. And that's why it's so challenging to diagnose and treat. Many times with an examination, it doesn't really reveal much, and we might get imaging, x-ray, MRI, and it still doesn't reveal much, but yet the patient still has an issue. They're still having back pain. Many times it's a case of what we do associated with what we don't do. Many of us sit for extended periods. Our posture isn't ideal. We don't exercise enough. We start to lose mobility in our hips and maybe our upper back. And I call that cumulative trauma. It's the day-to-day stuff that we're doing that can contribute to these types of conditions. So although it's maybe one of the most frustrating things that we deal with, back pain, we need to kind of look at the history of what we're doing day to day and pay a little closer attention to increasing the mobility and exercising and so forth, because I have so many patients that come into the clinic with, I didn't do anything, I'm frustrated, I've been to other physicians, the x-ray doesn't show anything, yet I still have this ongoing back problem. That's when I want to take more of a history of, let's take a look at what you're doing, what you're not doing, some things that we need to maybe be doing a little bit differently. Because degenerative disc disease, arthritis, those things, although they do show up on x-ray, it's not typically something that's going to cause a lot of discomfort or problems. It's associated with weakness around the core, tightness in other muscle groups, and so forth. So although it is very challenging, we do understand the acute conditions. Those chronic conditions, those more insidious conditions can be a little more challenged to manage. So it's my suggestion that we take a look at some things that we need to be doing differently. And as always, diagnosis is essential. So if you feel like you're having an ongoing problem, I think it's very important with back pain that you get into a physician, get properly examined, take a history, and then most importantly, keep moving.